Okay, hi. I'm going to show you some stuff about this drug treatment stuff we've been working on. I want to make sure that you're understanding how this works and how the choices we make with the treatment are affecting the results. So let's start with a simple
But I might put it in, and, well, I might put it in.
one single drug treatment, one large dose of A. So it had no effect on resistance. It increased the population. It cost us $1,000, and we had mild side effects. If we edit and add another day and add a dose of B, what changes? It costs more money. We increased resistance. No change to the side effects. Okay? So how do we actually kill more? So let's try adding a large dose of C. Okay, so now we have a little more resistance, we spend a little more money, and we have worse side effects. So we have 3 large doses. We're starting to see an increase in side effects and an increase in resistance, but no change in the population. Okay, so what is it that's actually going to decrease the population? Let's go back and edit this. Let's add another day of A. Let's try another large dose. Remember, A is the most expensive. So adding a second dose of A at the end drastically increased the symptom, the side effects, the cost, and the parasite population. So now we have mild resistances, but it made a big difference in the outcome in terms of the population. Okay? So let's try something. What happens if we change them all to small doses? Will we get the same effects if we change them all to small doses? So we got we got an increase. Okay, so we didn't kill as many parasites, but we had less side effects and less cost. So one important factor in managing cost and side effects is the size of the dose. Okay, so let's go back to edit. What if we change just the last drug to a large dose? We still have an increase. We still have about the same side effects, and we spent more money. Okay. What if we try making day 1 a large dose and making day 4 a small dose, and then ending with a large dose of B? We added a day. So now we have a big resistance to B. We killed more parasites, and we have moderate side effects. So instead of ending with that, what if we delete that day and change that last dose to large? So we start with a large A, end with a large A. What's going to happen? That didn't work as well. What if we double up on one of these? What if we go back to 2 and change 2 to a small dose of A, change 3 to a small dose of B, 4 to a small dose of C, and then end again with a large dose of A? what's going to happen.
Right, so I'm wondering if
So we have lower resistances,
we do that
but we have no change in the population. Now we're starting to spend more money.
tomorrow goes, maybe we do that.
So I wonder if we can just go in here and make like day 3 a large dose, what that would happen, what that would do.
That Monday, some practice, and then Tuesday.
Okay, so now we see that alternating the size of the doses actually cause the population to decrease. So we have a big dose and then a little dose. So we're killing, at this point, we've killed a large amount of the parasites, but we've increased the resistance
That's what I was
to
thinking
A.
about, like, do we think,
So after these 2 days, we've had a significant effect on the population,
should we make it
but we've also increased the resistance
so
of
that they
these 2. Okay?
can cut it out, glue it in?
So now if we give B, then we're killing all the ones that are resistant to A.
Or it would be their own and they just get glued.
And if we give a big dose, we're killing a lot of them. And then with C, we're killing anything that's resistant to B. Okay. What happens? Let's look at what happens just after day 1 and 2. So let's delete all the other days.
Okay. Oh, yeah, I think that. That's what I, cool. But yeah, it was like.
What happens if you just did this? Big, small.
Make sure you use your notes, pull out your notebooks, it's gonna help if you have your notes. And then you came in.
Get a
and-
large increase.
Right, but apparently we just needed.
And then if we add
It's true.
a day,
People.
a large B, then we see an increase. Okay. So we see here we have a large, we have almost no resistances to A, we have some resistances to B, and no real resistance to C. Okay. So now if we added back that small dose of C, we're down to an increase.
Interesting to see if.
We have some resistance to B and some resistance to C. So this is when we hit them with another big dose of A.
Yeah. It's less for, like, it's less time, like, when it happens, it's not like an extended 15 minutes.
Okay, so we end up with a decrease.
But
So the key part is you got to kill them first, and then you got to fight the resistances by switching drugs. Okay? And this final step is what really makes a big difference in decreasing the population. So you've decreased it, now you have resistance, so you switch drugs to fight the resistance, and then you switch drugs again. Okay? So what happens if we were to change day 4? If we change day 4 to a large dose, what difference is that going to make? We still have a decrease. We spend a little more money. We have slightly higher resistances, but look at our side effects. Okay? So if we can reduce the dose, that will reduce the symptoms. Okay, so this is one possible solution where we have really low resistances and we actually have a decrease, so it works. But the cost and the side effects are fairly high. So you might be able to change some of these. Remember, the large dose is good for decreasing the population of parasites, but it also increases the resistance and the side effects. The small dose can sort of help like a follow-up as a way to reduce resistance if you switch to a small dose, but ultimately if you really want to kill the parasites, you're going to probably have to use a large dose or 2. So it's large, small, large. A, B, C, A. Okay. Hopefully that helps.